number 3, 2024-776. All right, we have a motion and a second on the bill. Councilmember Johnson.
Thank you, Mr. Chair, for allowing me to speak to this bill. And committee members, thank you for indulging me with just a few minutes of your time. And today we have an opportunity to support a resolution that could profoundly impact Jacksonville's health, economy, and community resilience. In Jacksonville alone, around 112,000 residents lack insurance and many more insufficient medical coverage. And this leaves countless families who are forced to rely on emergency room visits as their primary source of health care. This is an approach that's unsustainable and costs a lot of money. And expanding Medicaid could cut millions of dollars in emergency room expenses. And this particular proposal that they are pushing helps to reduce the financial burden on the healthcare system as well as taxpayers right here in Jacksonville. There was an example I heard that I thought was so important about a woman who had access to medical care during her pregnancy, but after she gave birth, she suffered from gestational diabetes, gestational asthma, and her life was put at serious risk. Now, there were wraparound services that helped this woman, but had there been an expansion of Medicaid in the state, she would have not had to try to find wraparound services to get this life-saving care. And beyond the numbers, this expansion represents an investment in preventative health care, and we know of what it can do for the quality of life and the experience of people in our community. There have been many states who've seen this expand, and they have worked to reduce mortality rates and had a decline in chronic conditions. So I hope that you'll join me in supporting this resolution so that we can have a healthier workforce, fewer missed workdays, and strong economic growth. This isn't just smart fiscal policy. This resolution, which although won't be a change for us here in Jacksonville, but it will recommend to the state that we do this specific measures so that these benefits are seen here at home. Could the students stand? Would you all stand for a moment? They came up from Gainesville. I just want to thank them because that's a big thing for them to leave class and come over. And the big guy, future Dr. Davis, was one of our students at Edward Waters. So very proud of you through the chair. Very proud of the work that you're doing. And I look forward to one day turning my health care over to one or all of you in some form. Thank you for your work.
My name is Dr. Leo Alonso. I'm an emergency medicine physician. I have practiced in this county for 30 years in Duval and Clay. And in emergency medicine, we have an open door policy due to federal unfunded mandate called EMTALA, where we have to see everybody. The so-called Medicaid coverage gap affects about 300,000 Floridians. That's on the conservative end. You'll hear up to 500,000 in other quotes. And I just want to remind you that in this particular district, there is a huge income disparity, and really the need is huge in the city of Jacksonville. Thank you for your time.
You know, when this came on the agenda, I started doing my research, reading studies, reading results from those 40 states that had expanded Medicaid. And I wish it were as easy a decision as we ask for it and get more funding to provide more for those who sorely need medical care. But as with most things, there are second, third, fourth, and fifth, and maybe sometimes even more order effects by doing these things. And so what I was wondering through the chair, has anybody sat down, given Florida has had approximately 13 years, to request expansion of Medicaid. Has anybody gotten that feedback from the leadership on why?
In my book, this is just another tool in the toolbox, another opportunity for us to make certain that we provide our constituents the opportunity for access to health care.
With each year, the federal government will continue to pay for at least 60% of it. So the state's cost will always be 40%. So I don't understand why they continue to make the claim that it's going to have escalating costs. To me, once again, we're doing a disservice to not only the population in Jacksonville and Duval County that needs additional services, it's the entire state. And I'm going to say something that I've heard repeated multiple times on television. It's our money that we're giving back to the federal government that we're refusing to take. So this particular resolution, while I'm helping to co-sponsor it, and I'm wholly in favor of it, it's going to fall on deaf ears. It's not just about the cost that they need to consider. It's about the people.
I would rather not get involved in a process such as this because I'm concerned of the repercussions of telling our state legislators what to do. Even though there's times where they put some requirements on us. So I'm going to vote against it, but I recommend that those that are involved to lobby the appropriate people, which would be your state senators and your state reps.
It was said earlier that it's complicated. Honestly, if you take a look at the study, it's really not that complicated if you just simply read the study. Yeah, there is $17 billion that will be cost to Florida, not over 8 years, but over 10. But out of the $176.2 billion that will come, I read those same studies, and there's 6 other studies that said that health outcomes will allow billions of dollars to be saved in costs from Florida. I don't think this bill, my friends, tells the state legislators what to do. That's why it's called a resolution. It simply is to recommend something to be done. And what we'll understand is that the majority, or the top house, I know we said that the Florida legislators on the state level did not agree to this measure. Actually, if you go back and really do the research, you'll see that in 2015 and then since, the Florida Senate has championed this measure. In fact, I had dinner a few weeks ago with outgoing Senate President Pasajomo, who was an ardent supporter of this. So what you will know is that the Senate supported it and it was defeated in the House. And I believe that if counties in Florida, like ours, come together and share specific details as to how they believe that it will adversely impact Florida's counties and the funds that they have available by not passing this so that we accept those funds, I think they will listen more intently. So whatever you decide, I appreciate you listening. And again, I must say, the fact that these students came together to make this, to come to me, that's why I'm championing this, and I would do it and will continue to do it until it goes in. Thank you, Mr. Chair, for your indulgence.
You can open the ballot and record your votes.
Three yea, 3 nay.
All right, by your action, you have deferred 2024-776.